difference between a facelift and fillers? Hi, I'm Dr. Kristina Tansavatdi and I'm a double board certified facial plastic surgeon. In this video, I'm going to share with you what my thought process is between when we use fillers and when a facelift is the appropriate surgery to perform. So first, let's talk about the anatomy. Before I can even talk about what a facelift can do and what fillers can do, I'm going to talk about what happens to the face as we age. First thing I want to talk about is volume. Volume in our face is made up of really the bone structure underneath, the muscles, the fat pads underneath the skin, and then our overall skin overlying everything. And we have to look at what happens to the face as we age. One thing that happens is we lose volume, and that can be from both the bone structure but also the fat pads. In this picture here, I'm going to demonstrate here what happens to the face as we age. In our 40s, we're starting to thin in terms of the fat pads in the face, and in our 50s, you could see that really even gets smaller and starts to descend in the face. So there's a difference between volume loss, and then the second process is what we call sagging. And when we see sagging, that's happening because we've lost collagen in the tissues. The skin becomes thinner and looser, but also the deeper tissue, the fat pads themselves, lose collagen as well. The fibrous tissue starts to become weaker and the face descends. So you get sagging in the lower face. There's a couple words I want to describe, which is jowling, or this heaviness in the lower face along the jawline, marionette lines or folds around the mouth. And these are the things that I look at when I see and I look at somebody's face, because those are signs of sagging, not necessarily volume loss and not necessarily things that we can fill. So when we look at volume loss, that's where fillers are used. So hyaluronic acid fillers is one option. Another would be Sculptra. Other fillers on the market, what their purpose is filling in with volume to the areas where we've had volume loss. That's different than when we talk about what's happened to the face, that it's sagging. If we're losing collagen, if we're losing the thickness of the skin, the thickness of the tissues, and they're starting to sag and lose the elasticity, that's when I perform a facelift. That's when I suggest a facelift for my patients, because putting more volume is not going to lift that face. It's not going to reverse the signs of aging and can actually do harm. So let's talk about where fillers should not be placed, because when we put fillers in the lower face, we're adding to the sagging, we're adding to the heaviness. So the areas that I suggest fillers be placed, and they can be placed before surgery, is, and I'll show you the picture here that I want to demonstrate, is that fillers are okay around the eyes because we lose volume in the temples, we'll lose volume around the eyes, we'll lose volume in the cheeks. That is where fat gets lost, but as it descends and causes more heaviness in the lower face, we don't want to put fillers along this jawline. Where we can put fillers is in the lips, because we do lose volume in the lips, and around the mouth. Now, where fillers can, I find, become a problem is when it's used to try to hide the jowling or placed in the marionette lines. This can create more heaviness where we don't want it to be. And when I do a facelift, I will ask that the filler gets dissolved before the surgery, because it becomes in the way. And what I see in surgery is the filler being here causes some stiffness. It prevents me from getting the best lift. So if you are planning to have a facelift, that's one thing you'll want to consider, is making sure that you don't have fillers leading up to the surgery within 6 months to a year, and in fact dissolving some of that filler before your surgery. That allows your surgeon to do the best job possible to lift the face. So in this area, this is the area we don't want fillers. This is the area where I will be lifting so that we can improve the marionette lines as well as the jowling. Because if we lift in an upward direction, and all of us can do this, when you start doing this in the mirror, you know if you're pulling upwards and you're like, oh, my jawline looks nice and smooth, that's a lift. That's a facelift, and that's not fillers. Fillers provide volume, but they don't provide enough volume to lift the face. It will be used, fillers can be used to address volume loss that's causing maybe hollowing under the eyes, that's causing this tired appearance, maybe hollowing in the temples, that's also changing the overall shape of our face so it doesn't look heart-shaped anymore. Those are areas where fillers are used in the appropriate way to improve the appearance of the face. But where fillers and surgery differ, remember these two concepts. Fillers for volume loss, upper face mostly and in the center of the face, and sagging is a facelift. So there you have it. That's how I look at the face, and that's how you should think about whether you're a candidate for a facelift versus fillers. I hope I've answered your question here. For more information, please tune in to my facelift expert channel at Facelift Expert on our YouTube. Thank you very much.